Good afternoon, everybody. Thank you again for joining us today. I want to begin again, like I usually do, by expressing my gratitude. I want to thank all those people that are working so hard to keep Yukon going. Thank you to those people that are keeping the stores open, supplies on the shelves, to folks that are educating our children, keeping us safe, and working on policies that are guiding our work to support Yukoners. Thank you very, very much. Thank you to all Yukoners. Thank you for continuing to make the sacrifices that we are all making for the greater good. I don't often use examples of American politics in my comments, but you know, one exception that really struck me this week. This week I heard the governor of New York reflecting on a very dark question: how much is a human life worth? This is a dramatic question, and it's asked by somebody who is governing in a very different situation. But when I heard this, it definitely gave me pause. My team and I, and Dr. Hanley as well, and many others are hearing from Yukoners who want us to open up our economy and to lift restrictions. And I am also hearing voices at an even greater volume, pleading to keep things closed a bit longer, to keep up the vigilance. We are in a very different place than New York. We're in a very different place than Quebec or Ontario, for that matter. We have a small population and a lot of space to stay physically distant. We also have low infection numbers, and I have not, and we haven't seen that community spread as well so far. So we are in a good position, but we must maintain that vigilance that we've been doing so well with to this state. We are where we are today because of the incredible actions that we all have taken as a society. Actions taken by the Chief Medical Officer of Health and his team, by our government and other levels of governments in the territory, by businesses who voluntarily close or who have put heavy measures in place to stay open, and most of all, actions taken by you, Yukoners, to keep us all safe. So yes, we are eager to get our economy back up and running, and not for frivolous reasons either. We are eager to get things open because individuals and businesses are struggling. Many are in dire financial positions, and unemployment is on the rise in Yukon. It is on the rise all across the nation. There is no doubt that we are all in very challenging times. We are eager to get our communities back up and running. And I know deep in our hearts, Yukoners want to put a neighbor or a friend or a relative. They don't want to put any of these people at risk as well as we're turning towards this new normal. This is why our approach to recovery, to economic recovery, just like all other jurisdictions in Canada, are moving forward, and they're moving forward carefully. We will take a gradual and phased approach to reopening with a focus on protecting our communities and our most vulnerable citizens, and minimizing the risk of another wave of the virus. I will have further details on our reopening plan to share next week. I know that the recovery and the return to normalcy is on everyone's minds right now, but we must not let our guard down, and we must remain vigilant in the fight against this virus, especially in the north, where hospitals and other resources are far more limited. Our reopening plans outline principles, public health criteria, and indicators that will inform our government's decisions on readiness for the gradual lifting of restrictions, as well as the possible need to reintroduce certain public health measures if another wave of the virus appears. Hopefully not. What I can tell you today, Yukon's reopening plan is based on a national health framework and adapted to fit our territory's unique local economy. This is to ensure that we balance the need to prevent further spread of COVID-19 with the many unintended social, economic, and health consequences of the restrictions that we do have in place now. I know people are anxious to see a plan because we are seeing them being announced right across the country. I will remind you that Yukon did not put in the same level that other provinces had to put in as far as restrictions. Some are celebrating the reopening of public parks, for example, but our parks have always been open. These are, we are also seeing others celebrate the return of takeout options for food for restaurants. Yukon restaurants have always had that option. Greenhouses in some provinces can open in the coming weeks, and many of ours, well, they opened last week, and they were never required to close. So my point here is that Yukon is already at phase one for most people, most other jurisdictions. Yukoners should not feel that we are somehow behind the country in reopening our economy. We are in many areas ahead of other jurisdictions. Right now, we are working to support businesses that voluntarily closed, understand how they can safely reopen. We are seeing more retail spaces open up, which is encouraging. Popular summer recreation is getting going, like canoe rentals and lessons, and the start of the golf season. I understand Dr. Hanley will be speaking about guidelines for allied health professionals in a few moments, which is another big milestone that we have reached this week. And I know that that's going to be very welcome news for many people. We are also looking closely at businesses that have been ordered to close, personal services and bars, as well as non-emergency dental work, dining in restaurants, those types of things. Looking at how these types of businesses can reopen safely, that involves identifying the need and the availability of PPEs, the personal protective equipment, to allow for safe interactions. An announcement that I'm very pleased to make today is that we are finalizing our plans to open campgrounds this summer. Thanks to the diligent efforts that Yukoners took to reduce the spread of COVID-19, we are in a position to begin opening territorial parks and campgrounds on June the 4th. There is still considerable work to be done in advance of opening these parks. We will continue to work with the communities and the First Nations governments and municipal governments to make sure that they're comfortable with the plans that we are developing, and that we communicate to campers how to respectfully be respectful of the wishes of the communities. Camping will look a bit different this year for many obvious reasons. Campers will need to be diligent in practicing safe or physical distancing, in keeping the family unit or keeping yourself to a family unit or to households, bringing extra water for hand washing, following general rules that are put in place. We will also share information in the event that there are parks that cannot open for any specific reasons. We are in this together, and we know that Yukoners will use parks and campgrounds safely and respectfully this summer. Now, with the opening of campgrounds, we also need to be mindful about how Yukoners move around the territory. We are currently still recommending that people avoid any non-essential travel to other communities. Over the coming weeks, in close communication with First Nations and municipal governments, we will consider how to lift this restriction safely. This is very important, that this work is done with the community leaders so that they feel empowered and safe in this decision. We are working to lift restrictions for the sake of our mental health and our social and economic well-being, but we recognize that this cannot happen too fast, and we cannot risk having to turn back the dial and then tighten up again. And we're seeing this in other provinces, such as the school situation in Quebec, for example. As our government rolls out Yukon's reopening plans, all decisions will be absolutely based on the advice from the Chief Medical Officer of Health, and also guided by Canada's 6 principles for relaxing measures. There are restrictions that we are working to lift sooner rather than later, such as reopening of businesses that were ordered to close, but we do not anticipate lifting other restrictions like the strict border controls until later phases. Even if we begin relaxing health measures and reopening society, it remains a very real possibility that measures will need to be reinstated. This is a marathon, folks. It's not a sprint, and we have not yet seen the end of this pandemic. If we keep our borders controlled, we can look at relaxing measures. So, as we progress through the initial phases of reopening and getting residents back to work and moving a bit more around the territory, border controls will remain in place for the time being. This is because the importation of COVID-19 to Yukon is our greatest risk. We will continue to share information through media briefings and on our website, yukon.ca. I'm also happy to share with you a new telephone line that Yukoners can use to get non-medical information related to COVID-19, including current recommendations, restrictions, and government supports that are available to Yukoners and to Yukon businesses. The new line is for questions such as, can my grandmother move to Yukon to help take care of my children? Or can my business partner drive to get a new piece of equipment up from Alberta? Yukoners can reach the COVID-19 info line at 877-374-0425. So again, that's 877-374-0425. And that line is open, it will be opening up, if not right now, it's open today within the hour. And it's going to be open up for every day, 7 days a week, from 7:30 a.m. until 8 p.m. at night. The phone line is for non-medical information. Yukoners continue. Please use 811 for medical advice and 911 for emergencies. Operators will connect callers with the latest and most accurate non-medical information about COVID-19 for Yukoners. It will help individuals, businesses, travelers stay informed, including those in rural communities who have more limited access to internet. We are happy to have another option for Yukoners to access for very important information. Now, before I end today, let me note that this is Mental Health Week, and the Yukon division of the Canadian Mental Health Association is running a campaign called Get Real, where we ask, how are you? We often get that question, how are you? The Get Real campaign encourages us to look past the normal standard response of, I'm fine, and consider what the question really means. You know, there's often a lot lingering behind the standard I'm fine answer. You know, we're all dealing with our own personal issues, let alone the pandemic issues. And it's really important for us to reflect on what our real state is, and to make sure we reach out to family and friends and others as we talk about what's behind the line I'm fine. I know myself personally, it's Mother's Day coming up, and that's a tough time of year. It's a 1-year anniversary for my mother's passing, but I rely on my community members to help me with that. Had a great conversation just yesterday with a friend of mine in Dawson, going through very similar concerns. And so really, as we say to each other we're fine, now is the time to reach out to family members and to community members to get that support that people need, because mental health is extremely important now more than ever. As Premier as well, I think what keeps me sane in these times is knowing all of the amazing leadership that I'm seeing here in the Yukon right now. Whether it's through Brendan Hanley in his office, or all of the ministers, or the public servants. I mean, even as I look around the room today of all the people that are here helping to support the efforts of this government, I'm relieved that we have such great leadership in the Yukon, in every sector, the medical community, the business communities, the people helping out with our children. I'm just really encouraged that we have such great people working in such extraordinary circumstances. So, you know, as we respond with a simple, I'm fine, you know, we also have the people around us that are supporting us every day that we should be all very thankful for. I'm encouraged that Yukoners take some time to check in on loved ones today and during the weekend as well. We might all be fine, but I bet if you take the time for a longer conversation, there's a lot more behind that statement than most people say. So with that being said, Yukoners, enjoy the weekend, stay vigilant, wash your hands, stay 2 meters apart from each other, do not gather in groups more than 10 people, stay home if you're sick, avoid non-essential travel, and be excellent to each other. Thank you very much, and I'll pass it off to Brandon.
Thank you, Premier. Bonjour, good afternoon. Today is certainly one of those days to be grateful that our COVID-19 situation here in Yukon is so much different than other places in the world. The sun is shining as well, and the temperature's rising, and we can go outside as long as we can do so safely. So do go outside and enjoy the sun and the great outdoors. And by the way, while outside and observing the rules of safe social gatherings, I want to make sure that all of our healthcare providers who have been asked to avoid social gatherings while not at work know that you don't need to undergo this sacrifice any longer. As long as the rules on maintaining spacing and keeping numbers down to less than 10 and you are keeping the gatherings outside, then our valued healthcare workers can have their time in the sun as well as they deserve. But while we talk of sunshine and fun, I recognize at the same time that people are suffering. We all saw the headlines that Canada lost 2 million jobs in April, and we know that Yukon has had its share. I know that residents in long-term care are suffering from not having visitors. I know that the stresses of being over-confined and restricted in our social lives and our connection to services is building up. So we do need to move progressively to a more accessible and open society, as much as we can afford to, while staying safe from the pandemic. I know that people are wanting to get outside and to throw off the shackles of COVID-19 and get back to normal. Every day I get questions about why we need to keep things buttoned down so tightly when Yukon is doing so well. And that's the paradox. It's because we have kept things buttoned down that we are doing as well as we are. But there is definitely daylight ahead of us. And as the Premier said, we expect to have concrete plans to bring to you soon. Those plans, based on the federal framework, are for phased reopenings that rely on maintaining border control, keeping us in COVID containment mode so that we can ease restrictions within Yukon. Meanwhile, there is so much to do to support what I call the Phase Zero reopening, supporting opening or reopening in areas that have never been closed. For example, today we are providing guidance documents to allied health professionals who are advised that as long as they can adhere to these guidelines, they can reopen if they had to close down. This list includes registered massage therapists, chiropractors, physiotherapists and occupational therapists, naturopaths, osteopaths, and acupuncturists. Also, today we are sending guidelines to the optometrists so that they can also open to normal business as long as they adhere to the guidelines. Many of these services closed or reduced services themselves. Others were advised to close due to particular risks or circumstances. Either way, we appreciate the steps they are taking and their commitment to keeping their clients served and safe. We are continuing to work on guidelines for dentists and will be integrating advice for dental practices into the reopening plans. The dentists therefore remain closed except for emergency or urgent reasons. These are the beginning stages of reopening, and we will have more to say on this as we get closer to Yukon's plan for reopening being released. Earlier today, along with the Yukon's Chief Coroner and the Chief Superintendent of M Division, RCMP, here in Yukon, I issued a news release advising of 7 deaths in recent months, all due to drug overdoses. We grieve with the family and friends of those 7 individuals, and it's a reminder to all of us that even during a pandemic, we cannot forget the other urgent public health needs, like substance use addictions and overdose. People who use substances are still at risk of overdose, especially those using opioids. For Yukoners who use substances, the risk of overdose is much higher than the risk of contracting COVID-19. I know we've been telling people to physically distance and stay home, but if you're using substances, it's of utmost importance to follow harm reduction rules. Please don't use alone and have a naloxone kit handy. There are many resources and people out there helping and ready to help. If you're struggling or sad or just need a little help, please reach out. Although for years I have been warning about safe drug supply and how unreliable that is in this time of fentanyl and other artificial opioids, with the recent overdoses in the territory, it's important to recognize that now more than ever, usual supplies may not be safe. With all this talk of reopening the territory, and remember that both the Premier and I have said we need to maintain the strict controls in our borders, I want to acknowledge that reopening can be scary. There are people who are fearful that we are reopening too quickly or that lifting these restrictions will be premature. I hear you, I hear those concerns. I would say, since I hear a lot from people, about 50% think we're talking about reopening too soon. 50% say not fast enough. So perhaps we are right in the balance. As we prepare the plans for a phased approach to opening, we are learning a lot from the experience and wisdom of other jurisdictions, including the need for others to postpone certain steps, as you heard from Quebec. And we are working hard on giving guidance to businesses and workplaces and healthcare providers to allow them to do what they can do today or tomorrow before we need to go any further with reopening plans. At the same time, for those who have had difficulty accessing or have not been accessing healthcare, or to the elderly and those with chronic conditions or compromised immune systems who don't want any encounter with COVID, your lives, of course, are important to us. We will not play games of chance with your health. That's the reason we're moving slowly, deliberately, and gradually, because we want to ensure we have the protections in place for everyone. When services reopen, I want you to be confident that it is safe for you to attend with the proper hygiene practices in place, the businesses or services that are open. As we've noted previously, the business community has been phenomenally proactive, and we know they will continue to take every precaution to keep Yukoners safe. In the coming weeks, we'll be working not just with businesses, but with each sector or service to ensure that they know what is expected of them. My commitment is that my team will continue to provide the guidance for reopening while working to keep every single one of us safe. This weekend is a 22nd annual Run for Mum, this year being held as a virtual event. Somewhat bittersweet for organizers, while they can still host the event virtually on Mother's Day this Sunday, they're not able to see the hundreds of people who usually gather to celebrate their mothers by walking and running to raise money for breast health initiatives in Yukon. Some come with their mothers, some with their children. Some who were children are now mothers who use this annual event as a way to celebrate all mothers. Mothers only want the best for us, and we in this world thrive on their unconditional love that is always there for us, even after they have passed on. So don't forget to celebrate your mum this weekend, however close or far away. If your mum is close and you can visit, take her for a walk in the sunshine. Flowers by delivery or a breakfast in bed will never hurt. Wherever they are, and even while observing the Safe Six in these strange COVID times, let's all give a toast to our mums. Thank you. Merci, Cho. Merci.
Thank you, Dr. Hanley. Thank you, Premier Silver. We'll now go to the phone lines. We'll start with Gabrielle, Whitehorse Star.
Hi, I'm just hoping you could run us through a little bit. I understand that we're going to have more details about the plan to reopen next week, but I think it's been a long few weeks for everybody. What are some of the things that have been mandated to close that are going to be first priority for reopening?
Yes. So again, I recognize that folks are eager to see what the plan is going to be. We're giving information out as quickly as possible. We don't have a lot more to say about phase one because I agree with Dr. Hanley. We're in phase 0 right now, or the current state. Right now, I know that folks are working today. They'll be working into the evening. They'll be working all weekend, and by early next week, we'll have more to offer. But right now, it's really important that we, again, maintain what we've been saying all along. We're following the medical advice from the public health officers, and working in tandem with the hard work that Dr. Hanley and his team are doing to prepare regional specific concerns and considerations based upon these national considerations. I was watching my colleague Premier McNeil in Nova Scotia, very similar situation that he's in as well. He's getting a lot of pressure to announce the next phases in their announcement today. And again, as we look at these regions, we're already ahead of a lot of these regions already with some of the announcements that they have put firm dates on. And we will be right there in the mix next week and into the next weeks, giving information in as timely a fashion as possible. So appreciate people's patience, but also know I think we're in a very good place compared to other regions as far as recovery.
Next question, Gabrielle.
Okay, and I was asked today if there are any enforcement officers on the Haines Road. So enforcement officers speaking with Alaskans and travelers coming into the Yukon from the town of Haines, Alaska.
Yeah, so working with the Civil Emergency Measures Act through Department of Community Services, we have identified in each community folks that have the provisions of the current measures in place, and enforcement officers in most, if not all, communities.
Thank you. We'll move now to Jackie at the Yukon News.
Hi, I think my question is more for Dr. Hanley. It's regarding the overdose deaths this year. I was wondering if the Yukon is considering or has implemented any sort of safe supply chain.
Yes, considering yes, but not actioned yes, actioned yet. I think there are a lot of considerations in that. So I would say it's at the early phase of studying the issue and whether it's something that we would be able to implement here.
Next question.
Yes, and the CBC reported that in Yellowknife, a sobering center for homeless folks was set up, and that saw a reduction in substance abuse in some of the people who went into that center. Are there any plans to introduce something similar to the Yukon for our marginalized homeless folks?
Would you like me to?
I can add to it if you want.
Okay. I mean, it's certainly been a focus of establishing, at least in Whitehorse, the shelter and all the supports, plus intensive outreach supports. As you know, agencies like the Housing Outreach Service with social services, in addition to the NGO support and the NGOs, the outreach van, the blood ties. So really a spectrum of supports that are really trying to achieve the same concept without necessarily building another center. And we have seen, for instance, reductions with all the supports that have been in place at the shelter within Whitehorse, including, for instance, paramedics on site at the shelter. We have seen substantial drop-offs in visits to the emergency. So I would say definitely there are improvements in what we have seen with the bolstered supports and programming at the shelter. Naturally, that's not the only solution, and we continue to be plagued by these opioid deaths, many of them involving fentanyl, and can only try to emphasize the resources available for access to harm reduction services, access to fentanyl checking, access to support resources for wherever a person is in their spectrum of drug use.
Yeah, I don't have very much more to add. I mean, Dr. Hanley nailed it as far as us working in partnership with the NGOs and also the Whitehorse Emergency Shelter, also the mental wellness hubs right across the Yukon. It's hard to compare oranges and apples. I did talk with Premier Cochrane about who we focus in on in these unprecedented days. We're lucky in the Yukon with our elderly populations as far as our facilities. They're all publicly run, and we have the support supports in place, but it does turn your attention to the more marginalized individuals in our society, and making sure, as we know that could be a hot spot for the transmission. If we were in that situation, I know that this week has been a concentrated effort to make sure that we are feeding into the nation what regional specific considerations that we're doing and where the needs will be if we need some more measures as well. Our hearts go out to people in other jurisdictions, especially Quebec, when we see what's happening with our elderly populations. I believe that with all of the supports that we have in place right now, we're very well situated now and very well prepared for worst case scenarios, hoping to avoid those.
Thank you. We'll move now to Jane, CBC.
Hi. My questions are in regards to the campgrounds reopening on June 4th. You mentioned that the strict border control will stay in place until later phases of the reopening, but obviously people from Alaska or people traveling to Alaska and the Northwest Territories are allowed through. When the campgrounds reopen, will they be allowed to stay at those campgrounds, or will those campgrounds only be open to Yukon residents?
Yeah, no, it would not be. Firstly, we believe that the best way to keep Yukoners safe from COVID-19 and its is to align with the civil emergency measures orders that are in place now, and it's anticipated that enforcement provisions to prohibit parks and campgrounds use by those who are traveling through will be enabled with ministerial orders. So yeah, we'd love to share our world-class parks with our visitors and our neighbors. Just not now. That's not what they're for. What they're for really is, as we have these strict measures in place and we start looking at how we're going to start moving around so that people can get out a little bit more and enjoy the beautiful Yukon that we have. Our focus is on Yukoners. Typically, 50% of the parks are being used by Yukoners and 50% by visitors, by tourists. So we have a lot of space. We have a lot of parks, but we are concentrating on the use of those facilities for Yukoners only at this point.
Follow up?
Yes, and how will that be enforced then? Some of the campgrounds are in remote spots. Will there be, those FEMA or the enforcement officers there to make sure that people who shouldn't be there are not there, or how will that measure be enforced?
Yeah, so again, the enforcement provisions to prohibit parking, parks and campgrounds to be used by travelers traveling through the Yukon will be enabled by with those ministerial orders under the Civil Emergency Measures Act. So the current provisions that we're using right now for enforcement will be extended to the campgrounds.
Thank you. We'll move on now to Julien, Aurore Boréale.
Oui, ma question est pour Monsieur Silver. Est-ce qu'il y aura des services en français dans la ligne téléphonique qu'il vient d'annoncer aujourd'hui?
The question is for the Premier. Will there be French services in the new phone line you just announced today?
Absolutely.
Next question, Julien. Prochaine question.
Non, pas de question.
Merci. Claudiane, Radio-Canada.
Oui, bonjour, Dr. Hanley. Possible de nous donner un peu les grandes lignes, des lignes directrices qui vont encadrer le travail des massothérapeutes, des ostéopathes, des gens là, de la liste que vous avez annoncée aujourd'hui? Comment est-ce qu'ils vont pouvoir faire leur travail en fonction des directives sanitaires?
The question is for Dr. Hanley. Can you give us a general idea of the guidelines that will be provided for the parallel medical services that are going to be offered by masotherapists and others?
Oui, c'est dans deux parties plus ou moins. Donc, une, c'est pour faire un triage selon les symptômes dont une personne peut avoir. Donc, c'est juste pour vérifier, effectivement, pour vérifier que une personne qui a besoin d'un service ou qui désire le service n'ont pas de symptômes respiratoires, n'ont pas des autres risques que peuvent emporter un risque de COVID. Par exemple, un voyage dehors de Yukon dans les derniers 14 jours. Donc, la première partie, c'est pour ça. C'est aussi de conseils sur comment avoir le salon d'attente pour respecter les règles de distance physique, pour donner la parole, effectivement, pour comment trier les gens par téléphone 24 heures avant, effectivement, et puis en arrivant. Aussi pour les cas, dans certains cas, donc s'il y a pendant la thérapie, les guides pour la sanitation, le lavement des mains, donc toutes les mesures de sécurité pour éviter une situation de transmission de COVID. Donc, I'll just repeat quickly in English. The question was about the general framework for the guidance that we're offering to allied health professionals, and it's really about how to do a risk assessment for possible COVID risk factors, including the presence of symptoms, for encouraging deferral of service in case of symptoms, and then guidelines about how to maintain safe distancing and sanitation and hand washing and all that within the service area, how to ask the right questions for doing the risk assessment, and also for guidance around just the basic protections to prevent any possibility of COVID transmission within that environment.
Prochaine question, Floriane?
Oui, donc, par rapport à l'industrie touristique, les entrepreneurs sont très inquiets par rapport à la saison qui est essentiellement annulée, mais aimeraient savoir justement si la saison est carrément annulée ou pas, ou est-ce qu'il y aura des mesures mises en œuvre pour essayer de les soutenir?
The question is about the tourism industry. The businesses working in the tourism industries are really eager to know if the season will be totally canceled or if there will be some aspects of it that will come into play later on during the season.
Yeah, again, we've announced today that our first phase really is going to be looking at how we can mobilize Yukoners, knowing full well that there's going to be a continuation of the strict border controls, and that applies to not only just people's mental health and getting out, but also to Yukoners, tourism inside of our own territory. It's really hard to go any further past that because a lot of our phase 2, phase 3, and beyond is so determined upon whether or not the phased approach in BC and Alberta and other jurisdictions works or doesn't work. So again, we will follow the epidemiology to be sure as far as we look at next obvious phases. But right now, we really respect the recommendation that the border controls really are the reason that we don't have a curve and that we're in the current state what we are with no cases for 3 weeks. And as we look towards the next phase, it's about how do we as Yukoners mobilize ourselves more.
Thank you. We'll move now to Steve, CBC.
Hi, this question is for Dr. Hanley. Have you identified any specific reasons for this spike in death in regards to the drug-related death?
No, from looking at from working with the coroner and looking at the circumstances, it appears to be very similar to the spikes that we have seen from time to time over the last almost 4 years, so I would say that really kind of the continuation of the same pattern. Mostly male, mostly middle age, and mostly with some kind of either co-ingestion of other substances or a history of substance use. So I don't think they're necessarily connected cases. I just think that it's a continuation of patterns that we've seen before.
Next question, Steve.
Aside from sending out the press release and this news conference, what is the Yukon government specifically doing in response to these 7 deaths?
Yeah, I can give a few things. One is, of course, just re-emphasizing the services that are already out there. So for example, the referred care clinic in Whitehorse is the primary care clinic for these individuals, for individuals who are seeking opioid substitution therapy, for example, along with social and psychiatric supports. And the opioid treatment services clinic, particularly within the referred care clinic, and that sort of often that mix of medical problems and substance use disorders is within the catchment, as it were, for referred care clinic. Wide distribution of naloxone kits again has been available for the past 3 years, and really emphasizing the equipping Yukoners, anyone at risk, with naloxone kits. Blood Ties 4 Directions has been very active, continues to be very active through these pandemic times. They have just produced a great infographic for safe drug use during COVID times. They also work rurally, not just in Whitehorse. Just trying to use all of our agencies, the outreach van, the First Nations that we work with, to continuing to get the word out about use of if you're using, how to use more safely, recognizing that, as always, this is a dangerous time to use drugs. So it's natural to feel a little bit powerless when we see deaths continue to occur, and I think really just re-emphasizing what we can do that's out there to support people in need, and continue to try to get the message out.
We'll now move on. Gord, Yukon News.
You mentioned the plan has phases. I was wondering if you had an idea how many phases there could be.
Yeah, so again, I know folks want to hear more about the plan. I think our updates on allied health services, campgrounds, we're giving you the information that we can at this point. More information will come next week on our phased approach. But you'll see very similar, right across the nation. There's so many conversations. We talk at the Council of Federation weekly. We talk at the Federation of the First Ministers meetings weekly as well, the finance ministers. There's a coordinated effort internal of government, and Dr. Hanley, same thing with his colleagues right across the nation. What you are seeing in this country is massive coordination amongst the regions and with the federal government supports as well. So it will be very similar to other jurisdictions. We get an opportunity by looking and having these conversations at best practices, as we said before, right across the nation. Really encouraged with some of the work that's being done in other regions, and really heartened by the solidarity right across the country when it comes to procurement of medical supplies, helping out and support as far as policies and development, and also a federal government that is listening to the concerns flexible, turning and pivoting on federal announcements that work for the regions, and partnering with the folks that are best suited to make these decisions, and those are the folks in the regions and the provinces and territories, the leadership there, to make sure that all that we do is coordinated and we maximize the benefit to people that are struggling in the current times.
Gord, do you have a follow-up?
I have no further questions.
Thank you. We'll move now to Tim.
Hello, good afternoon. I spoke with the owner of one Whitehorse hair salon over the last couple of days, and she says she's trying to reformulate like her reopening plan, but she hasn't really heard much from the government and from the Chief Medical Officer of Health in what that would entail. And she said she's also trying to source PPE, but is having difficulties. Will you be giving hair salons, barbershops, any heads up, and what would your advice be for those who are trying to source PPE already for when we do reopen?
A really good question on giving folks the heads up. That's an extremely important part of planning. We can't just throw things at people and say, as of now, as of today. So we will be working in tandem with the Business Advisory Council to make sure that questions on personal protection equipment, but also on when and how we're going to open are clarified, and making sure that there's clear communication moving forward. And I will do a shout out right now to the person who does my hair. When and if we get back to this normalcy, please, I'm asking for an appointment, that's for sure.
What? We can't hear. Go ahead.
Oh, am I on? Okay. I just want to add, I agree with what the Premier said. But I certainly have heard from many of the hair salons, and there's been some very thoughtful planning on their part. I must say, so we're definitely paying attention. Definitely it's on our list for preparing for answering their questions, including how do they also do the risk screenings, not unlike what we're preparing for the allied health professionals, but of course at a different level, being not healthcare providers per se, but providing personal care. So definitely more to come, more details, and more conversations with the business owners themselves.
Okay, and a separate question for Dr. Hanley. It is nice this weekend. People are going to be thinking about barbecuing. We all know the 10-person or less limit. Can you remind us of the advice of what people should do if they're thinking about having 10 people or less in perhaps a setting?
Yeah, thanks. A good reminder. I hope there are lots of barbecues. I hope there are lots of safe barbecues, given that the fire, the wildfire needle is already starting to rise. So just being very conscious, everyone, of fire pits and fires and permits and all that kind of thing. Just one thing that is certainly a big worry for me from now through the summer. Is keep the gatherings outside, please, and make sure that the gatherings are less than 10, as you say, Tim, and also that the spacing is well considered.
Thank you. That's all the time we have today. The next COVID update will be Tuesday, May 12th at 2 p.m. Thank you, Premier Silver. Thank you, Dr. Hanley.